Good afternoon, everyone. Thank for the organizers for inviting me. The community research of autism is new to me since I'm a researcher based in mental health and suicide prevention. But from the last few years, I've been studying suicide risk among autistic people, and I'll be showing you some of our results on that topic. I do want to start out by saying in the way that we conduct our studies, the two main studies that I'm going to show today have been conducted as a part of a collaborative research group that brings together researchers from different disciplines together with autistic community experts, and we try to come as close as possible to the guidelines of participatory research. I think some of the time we do a better job in that, but some of the times it's challenging and we succeed less. And what we do is we kind of discuss and talk about research in the different stages of research, starting from which research questions to address, what measurements to use, to recruit participants, how to analyze and interpret data, and also bringing together documents for publication. And we do it together with community experts. Just to give you one example of how this has impacted our work, is that in our documents, we try to include a kind of standard DSM definition of autism, but also to include description of autism based on community knowledge and include references from community knowledge. And the first kind of big question that we wanted to ask is are autistic people at elevated risk for suicide, and autistic people specifically living in Israel, are they at elevated risk? Um, just to say a few words about suicide in Israel, these are the most kind of updated data from the Ministry of Health. There are annually between 400 and 500 people that die by suicide in Israel each year. Compared to the world, our rates are not that high, which is positive, but still could be lower. We have a total average of 6.4 rate of suicide per 100,000 people. And there's always the gender gap that males die more by suicide compared to females. And when we look at suicide attempts, serious suicide attempts that need medical care, we have about 7,000 cases a year, and with an average, women attempt suicide more than men. And when you look at the age difference, it's interesting to see that adolescents and young people are at elevated risk for suicidal behavior. And actually, this is the finding kind of made me cross into the research of suicidality and autism, because I'm a faculty member in the Faculty of Education, and we have a school-based program for suicide prevention in the Ministry of Education that's called Choosing Life. And it's implemented in ninth graders. And there was this need from educators saying there's a lot of suicidal sayings from students that are autistic, and we might need this intervention for autistic classes as well. And but it needs to be adapted. So we had a long study of adapting together with autistic people, parents, and educators, adapting the Choosing Life program. It was a dissertation project by Michal Ben Eli, who's a member of my lab. I'm not going to focus mainly on that today. It's also, I think, important for us to know that there is a suicide prevention national program which kind of maps risk groups. So immigrants and LGBTQ are considered risk groups, and other people, but autistic people previously had not been mapped as a risk group. And when we reviewed the literature on suicidality and autism, when we looked at the indicator of death by suicide, large scale studies from different countries indicated that indeed autistic people are at elevated risk of suicide, especially autistic people without intellectual disability. It had a different kind of increased risk in different countries. There was a sevenfold increase of risk in Sweden, but a twofold risk in Finland. And when we looked at studies that reported suicide attempts, serious suicide attempts that were registered in emergency departments, There was a threefold risk in Denmark. In our own study that was conducted in collaboration with the GEA Mental Health Hospital and Clalit, looking at all the data from Clalit, our preliminary results indicate a twofold risk of serious suicide attempts among autistic people compared to non-autistic people. And when we look at additional suicidality risk factors, specifically suicide ideation and suicide attempts as reported by caregivers or self-reported, although there's a high heterogeneity between samples, meta-analyses do indicate that suicidality is increased among autistic peoples, even looking at these markers. In our own study, we had 154 autistic adults that took part in the study, and we were looking at suicide ideation and suicide attempts as self-reported. And what we found was that 63% of participants reported that they experienced suicide ideation during the past year, some level of suicide ideation, and 25% experienced active suicide ideation. 90% reported that at some point during their life they experienced suicide ideation. We also kind of looked at a specific risk group that had kind of a more intense suicide ideation, which was about 20% of the sample that experienced suicide ideation. We also asked about suicide attempts and found that 28% of 25, percent of participants reported they attempted suicides at some point during their life, and 3.5% reported they attempted suicide during the past year. We also asked people, when you experience a suicide ideation, did you tell anyone about it? Did you disclose experiencing suicidality? And we found that 70% reported they did, and mostly reported they told a professional or a family member. And these are actually, I think it's very optimistic to know that disclosure is critical for suicide prevention. And these are rates that are higher compared to non-autistic samples reported elsewhere. So it might be counterintuitive, but it's a good finding, I think. When we cross-reference kind of these rates compared to samples that are looking at similar suicidality indicators in other samples in Israel, we indeed find some preliminary results that these are indeed a risk group of autistic adults or a risk group for suicidality. We did try not only to stay in the lab, but kind of to take action and bring this knowledge to the field. And we organized a 2-day conference together with the autistic community member in the association of ASI and Otsafot that also spoke in the conference and were part of organizing the conference. And the first day was kind of bringing the knowledge from the world and from Israel to be accessible to parents, autistic people, and professionals. The second day was a roundtable day of stakeholders that was kind of its goal was to map challenges and needs in the field of interventions, continuity of care, which is critical for suicide prevention, and in research in the field of suicide prevention among autistic people. When we continue the risk, maybe I've convinced you that indeed autistic people are at elevated risk for suicidality, but then we want to ask, why is this elevated risk? And when we look at the literature, we see that many of the known risk factors, from research in the general population, are more prevalent among autistic people, specifically maybe trauma that's been talked about today, and the bullying and depression and other well-known factors. There are risk factors in the general population for suicidality. And we also the literature points to a few unique risk factors that are unique to living and being autistic. And I'm just going to tell you about this second study of ours that looked at two specific risk factors that are specific in the context of being autistic. And also it may be that some of the known risk and protective factors that we know from the general population come into play in a different way when we're talking in the autistic context. And there's some indication of that in the literature. So in this second study, we also kind of brought the question of what are the most pressing issues that we need to be studying in the field of suicide prevention among autistic people in Israel. Many issues came up, but the one we kind of started to focus on was the factor of autistic burnout. So, autistic burnout has been talked about in the autistic community forums, but has been academically and systematically studied by Ray Marker in 2021. Basically means that the pervasive ongoing stress of living in a mismatch of expectations and abilities without adequate support brings autistic people to kind of a ongoing exhaustion. And a beautiful, I think, quote from that Raymaker study is having all your internal resources exhausted beyond measure and being left with no cleanup crew. These are some from our qualitative studies, but I'll have to go faster. Another factor that we took into account that we thought was important in the context, in the unique context of being autistic, is camouflage. It's been also talked about earlier today. Kind of feeling the pressure to hide autistic traits, either by imitating neurotypical behavior or inhibiting spontaneous autistic body language. And previous qualitative and quantitative studies have shown an association between camouflage, depression, anxiety symptoms, and decrease in well being. So, in this study, we had a sample of 92 autistic adults, and we used the self report standardized measures except for a burnout. Actually, there were no self report measures for burnout for autistic burnout. So, together with our community experts, we adapted an existing burnout exhaustion measure. And our sample had 90, as I said, 92 autistic adults that took part in the study. We found a positive correlation, which was pretty strong, between camouflage and depression and between burnout and depression. And when we compared the participants who reported suicide ideation and did not report suicide ideation during the past year, the participants who had experienced suicide ideation were higher on depression, on burnout, but there were no significant differences in camouflage. We also, because we thought together with our community experts that autistic burnout is perhaps a very critical factor in understanding both depression and suicide ideation. We wanted to see if it perhaps a mediator. So we did not mediate the unsignificant association between camouflage and suicide ideation, but we did find a partial mediation between camouflage and depression via burnout. So, which basically this means that the more autistic individual tends to camouflage, the greater risk he has of experiencing burnout and the greater risk of experiencing depression, which kind of makes a lot of sense. Like in any research, we're kind of trying to figure out what's the bigger puzzle and what's kind of what are the risk factors that are dialing into the risk for depression and the risk for suicidality. How does the everyday stressors of being autistic dial into those mental health factors? But we're still a lot that we have to study in research. Just to acknowledge a few limitations in our study, I think we need to replicate our findings in more representative samples and larger samples. We're aiming at doing some longitudinal studies, and we can also always refine kind of our self-report measures. But the main, I think, message that I want you to kind of take from this talk is that, first of all, I hope I've been able to convince you that indeed autistic people are at elevated risk for suicide, which means that we need to be screening autistic individuals for suicidal risk. And if someone is suicidal, then we need to also kind of confirm and consider autistic traits and check that as well. And when doing the suicide risk assessment, We need to be taking under account both the known and common risk factors for suicidality, but also some unique risk factors that are unique to the context of being autistic. Perhaps autistic burnout can be considered like an early marker that can potentially escalate to depression and suicidality. It should be acknowledged, I think, that there's big gap and lacking in suicide prevention interventions and measures. Currently in the lab, we are adapting the safety plan to the visual and processing needs of autistic individuals. So hopefully we'll find the positive results from that and it will be effective. And we're also adapting the interpersonal psychotherapy intervention to treat autistic individuals experiencing depressive symptoms. Um, and also, I think most importantly, perhaps, is kind of it's a call, an invitation for everyone. It's important to include autistic individuals in all stages of research. It might be kind of takes more time, but it for us it was made our findings more significant and our understanding of the findings more profound. So thank you everybody for listening.